is a disease that affects the blood vessels outside the brain and the heart.
blood vessels இல்லாத இடமே இல்லை.
Amputation is very present.
Proper treatment at correct time so that they can save their limbs.
If those measures fail, then there are different treatment options.
Their limbs and to save their lives.
கால்களுக்கு டெஸ்ட் அட்லீஸ்ட் ஒன்ஸ் a year ஆச்சும் பண்ணிக்கிறது.
So it was a successful event.
Today one of the operator for live sessions, and I'm your MC for today's event, and I can assure you it's going to be a really exciting day with a lot of academics, interactive sessions, and of course in the evening there is a CME with a cocktail dinner at Radisson Blu.
Function of Love Your Limb, and it's also my pleasure to welcome and thank our guest, our honorable guest, Dr. Sven Braunlich from Germany. I'm sure you are in for a very interesting session. Some of you may not know about GKNM Hospital. Just a brief note. We started in 1952 as a 50-bed hospital. At that time, we are a women and children's hospital. Today, we are a 620-bed multi-speciality tertiary level care hospital. We provide broad spectrum of services from birth to death. And we have primary centers to take care of people who cannot afford to pay. And also we have a center for terminally ill patients called Raksha with 15 beds. We provide free care. Our founder's dream, that is Mr. Kuppuswamy Naidu's dream, was to provide high quality education and also good health. He believed that we should provide accessible care, high quality care that should be patient focused. With that in mind, along with our vision of providing best possible care, accessible care to the community that is quality oriented, that is effective, that will help them to lead a high quality life. We pursue that dream every day, and today's meeting, interactive session on Love Your Limb focuses on how you can improve quality of life when you are struck with a disease called Peripheral Artery Disease. So I welcome you and I thank all of you here. I'm sure you are in for a very interesting session today. Thank you.
Great pleasure and honor for me to be here. Following your invitation to share experiences in the treatment of critical limb ischemia, which is very present, especially in the patient with diabetes mellitus. And we know India is a country with a high prevalence of the diabetes mellitus. And this subsequently can lead to clotted arteries, as you might know, and lead to critical ischemia, which means that patients present with ulceration, with gangrene of the foot, and untreated, this disease will lead in 50% of cases to death within the next years. So it's very important to treat these patients with gangrene and with ulceration to prevent major amputations of these patients and to save not only their limbs, also to save their lives with our treatment. And so I'm looking much forward to do some challenging cases together with Dr. Ranchan here, and as I said, to share some experiences how to treat this kind of disease with novel technologies like drug-eluting technologies, in order to save limbs and to save lives. Thank you very much.
Thank you, Dr. Sven. With this, I think we together will be going to our lab, cath lab. There are some cases becoming ready for our procedure to start. And you can interact with us from here. It will be live telecasted here.
My name is Dr. Sven Braunlich. I'm an interventional angiologist and cardiologist from Leipzig, Germany. I come from a center that is treating diabetic patients with ulceration and gangrene, and our goal is to treat this patient to prevent major amputations in these patients in order to save their limbs and to save their lives. It is very important to share these experiences also with our colleagues here in India, because amputation is very present and we should take every effort to try to avoid these amputations, and that's why we started here the program Love Your Limbs in order to save limb and to save lives.
Today we are organized Love Your Limb. This is an interactive session updating the skills and teaching newcomers to how you can save the limb when the patient is suffering from severe peripheral arterial disease. Peripheral arterial disease is a disease that affects the blood vessels outside the brain and the heart. It's important that they get treated. There was a thinking that this kind of disease is more common in Western world, and it's really not true. Research shows anywhere between 2.2 to 6.2 million Indians are affected by this peripheral vascular disease. This peripheral vascular disease has a lot of significance in that it can affect your lifestyle. GKNM Hospital's vision is to provide high quality care that's patient focused, and also our vision is to improve the life. Life in that, what I mean is improving the quality of life. With that in mind, we conduct several programs, both educational and community service programs. And this program is intended to increase the skills of interventional radiologists or any interventional physicians, how they can save the limb when they are affected by serious peripheral artery disease that occludes the blood flow. Eventually, that can end up causing them a lot of pain, ulceration, and gangrene, eventually end up amputating the leg. So we'd like to prevent all those. There are preventive measures. If those measures fail, then there are different treatment options. That is what this session is about. I'll thank all the delegates who came for this program. I'm sure it's going to be an exciting learning session for all of them. Thank you.
And I'm Dr. Srinivasan, a consultant endocrinologist in GKNM Hospital. Today we are having a camp for peripheral vascular disease, and peripheral vascular disease is more common in diabetic patients. Indiaல வந்து இப்போ diabetes patients are very high in number. நம்ம சைனாவை விட ஓவர்டேக் பண்ண போகிறோம் இன்னொரு 5 yearsல. Diabetes itself is a problem of blood vessels. If blood sugar is very high, blood sugar ரொம்ப அதிகமாகவே இருக்குது அப்படின்னா it will affect the blood vessels. Blood vessels இல்லாத இடமே இல்லை. So it can affect the heart, it can affect the kidneys, it can affect the brain, and it can also affect the arteries, ரத்த நாளங்கள் கால்லையும். காலில் அஃபெக்ட் ஆகும்போது தான் அதுக்கு பேர் வந்து பெரிஃபரல் வாஸ்குலர் டிசீஸ் அப்படின்னு சொல்லுவோம். இப்போது அது மாதிரி அஃபெக்ட் ஆச்சு அப்படின்னா ரத்த ஓட்டம் அந்த கால்களுக்கு தடைப்படலாம். அப்படி தடைப்பட்டுச்சுன்னா ஏதோ ஒரு ஸ்மால் இன்ஜுரி ஏதாவது ஆகுது அப்படின்னாலும் அந்த புண்ணு ஆறுறதுக்கான டிலே ஆகும். இது டயபிட்டிஸ் ரொம்ப ஹையாக இருக்கிறப்போ நம்ம வந்து கால்களை பாதுகாக்க வேண்டியது நம்ம கடமை. இங்கே எங்கள் ஹாஸ்பிட்டல்லையே நிறைய பேர் வந்து அட்மிட் ஆகும்போது அவங்களோட கால்களை பாதுகாக்காமல் ப்ளட் சுகரையும் ரொம்ப வருஷம் கவனிக்காமல் 10 வருஷம் கவனிக்காமல் இருக்கிறாங்க அப்படின்னா it can affect the legs as well, feet as well. So you have to be very careful. இதை ஏர்லியாகவே டயக்னோஸ் பண்ணி அதை வராமல் ப்ரிவெண்ட் பண்ணுறது வந்து வைஸ். ஹவு டு வி ப்ரிவெண்ட் இட் அப்படின்னா டயபிட்டிஸை நல்லா கண்ட்ரோலில் வச்சுக்கிறது, கால்களை வந்து நல்லா பாதுகாப்பாக வச்சுக்கிறது, ஸ்மோக் பண்ணிங்கன்னா ஸ்மோக் பண்ணாமல் இருக்கிறது, கால்களுக்கு டெஸ்ட் அட்லீஸ்ட் ஒன்ஸ் அ இயர் ஆச்சும் பண்ணிக்கிறது, இதெல்லாம் வந்து ப்ரிவென்டிவ் மெஷர்ஸ். இந்த மாதிரி பெரிய ப்ராப்ளம் வராமல் தடுக்கக்கூடிய ஒரு வழிமுறைகள் ஆகும். எல்லோரும் இந்த கால் பாதுகாப்பு பண்ணி டயபெட்டிஸ் இருக்கிற பேஷண்ட்ஸ் பயனடையுமாறு கேட்டுக்கொள்கிறேன்.
We want our patients to have a better life, better quality of life. That is the aim of GKNM Hospital, and that's why we do every day. And programs like this increases the awareness of the public.
If balloon angioplasty is not successful sometimes, then we put a stent, that is called this is stenting. So now the new technology has come, like a drug coated balloon. So balloon will be coated with some medications which will prevent the restenosis of the vessels. So that's what we have done. Our case first live workshop was on drug coated balloon technique. So 3 more cases are there. So we'll be continuing those cases also after this.
Yeah, to emphasize this again, our technology is does not require any surgery, any cut into the skin, any general anesthesia. This is all done by a little stitch into the artery, providing also maximum comfort to the patient without any operation. It's just like a little puncture to take a blood sample.
Today we have done complex peripheral vascular disease cases, live workshop with Dr. Sven from Leipzig, Germany, who is the co-organizer of Link conference. So it was a successful event. We could successfully performed the peripheral vascular disease below knee long segment SFA with drug coated balloons, stents. So it's a successful event, and we could send the message of treatment, different modalities of treatment of peripheral vascular disease among the public, and the awareness also for diabetics, especially diabetics patients to for their awareness of peripheral vascular disease, limb pain. They should not neglect. If a diabetic patient is having leg pain after walking for certain distance, they should not neglect that. They should consult their doctors, they should consult their diabetologist, endocrinologist, and they will do a simple test like ABI and Doppler, and by that they can diagnose peripheral vascular disease easily. Once it is diagnosed, then with medication they can control to a larger extent. When it is not controlled by medications, then they come to us and we open the vessels by using different techniques without surgery, by putting small needles, balloons, stents, drug coated balloons, drug coated stents to open the vessels, so that the blood supply to the limb increases and we can save the limbs. Once amputation means, you can imagine the patient without leg, the life will become so difficult for them to manage. So better to take precaution, better to get the treatment, better to have the proper treatment at correct time, so that they can save their limbs. So that's why we have started this campaign, Love Your Limbs. Hopefully we can save few more limbs, and we can educate the public, educate the patients regarding the magnanimous amplitude of this problem in general population, so that it will help them in preventing the limb loss. Thank you.